All right, everybody's good? Everybody's good? We're not late. Y'all just early. Okay? We're not late. Y'all just early. It starts at 10. It's 9:39.
For the past 3 weeks, Dr. Ayla Stanford has had a line out the door at her pop-up vaccination sites in Philadelphia. She now has more than 16,000 people on a wait list to get one of the roughly 1,000 vaccines she distributes each week. But unlike the line seen in many places, the majority of her patients are Black.
Okay, so that's that. We invited 600 people today, and the data is that African Americans are most impacted from this disease in our city, and that is our focus.
As states across the country work to vaccinate as many people as possible by standing up mass vaccination sites, Stanford is focused on breaking down barriers to access for those most impacted by the virus through a grassroots effort. With the help of volunteers and some paid staff, the Black Doctors COVID-19 Consortium has vaccinated more than 2,000 Pennsylvania residents.
It's going to be really quick one then. Here we go.
We're the answer for every need in the community.
Good job.
Every need. Latinx community, it's us. Homeless, it's us. Black is us. I need more vaccine. I need more personnel. And I need sustainable financial support. Because right now, everything we're doing is based on my bank account, donations from a GoFundMe. Thank you, everybody.
In Pennsylvania, white residents are vaccinated at a rate 4 times that of Black residents, even when accounting for differences in population size. And the state isn't alone.
I think people underestimated the ease with which you're going to get people who were hesitant to take the vaccine.
Early data from the 16 states that track vaccine distribution by race shows that in every state, Black residents are significantly underrepresented in vaccinations. This is true even among diverse vaccine-eligible groups like healthcare workers and frontline staff.
That's something that most of us, including myself, were taught as young children, that you don't go to the hospital when you're sick. You go when you're about to die, because that's the only time you would trust going to a hospital. You can't flip a switch on that quickly. That takes time and listening.
Did it make a difference to walk into that vaccine site today and see doctors and practitioners who look like you?
It made a world of difference.
Initially, 69-year-old Dolores Williams had decided not to get the vaccine.
And so there's always that fear, like when we go into the hospitals, go into the doctor's offices, you don't get the same treatment oftentimes as our white counterparts. Even down through history, you have the Tuskegee experiment, Henrietta Lacks, all of those things are just reminders for us how manipulative the system can be.
But after hearing Dr. Stanford speak about the safety and efficacy of the vaccine, Williams decided to give it a shot.
Well, a couple of my classmates, they died of COVID, and then I have a cousin, she's in the hospital right now on a ventilator. We can't avoid it. What's the alternative? Just going to funeral after funeral after funeral because of the COVID? I said, what am I fearful of? You know, I get flu shots, I get pneumonia shots.
While building trust with patients like Williams is part of the solution, the other problem is a lack of access to the vaccine in underserved communities. In the past week, headlines from across the country revealed that in some states, a majority of vaccine allotments have gone to wealthier and white neighborhoods.
If you want equity, you cannot leave it to the individual that is administering the vaccine. It's something that really has to be mandated.
Mandated by the government. President Biden has promised to make equity a focus as he rolls out a plan to vaccinate 100 million Americans in his first 100 days in office. Do you trust that he's going to be able to deliver on that promise?
I'm optimistic. I'm optimistic. I just, I need to see it.
Yeah, hey, Allison, good day to you. So as you know, airline travel is really very depressed. We're at about a third of the passenger level that we had a year ago because it's the dead time of year. And of course, on top of that, we have COVID. But we're right now talking about an effort to try to keep those foreign variants of the virus at bay, to try to contain them and keep them overseas. So we're talking about international travelers coming back to the U.S. This morning, as travelers take to the skies overseas, new guidelines take effect. Starting today, the CDC says passengers traveling into the U.S. from any foreign country must show proof of a negative COVID-19 test before their flight.
It's a beneficial rule for everyone.
Getting those negative test results gives us an extra line of protection.
The new measures aim to curb the spread of COVID-19, which has already taken more than 420,000 American lives.
I think if we really want to get back to the kind of travel we had before the pandemic, we're going to need to do a lot more to build confidence in the system.
President Biden signed a proclamation Monday that reinstates COVID travel restrictions, which were rescinded by President Trump days before he left office.
With the pandemic worsening and more contagious variants spreading, this isn't the time to be lifting restrictions on international travel.
Biden's executive action bans non-American citizens traveling from South Africa, where there's a new, more contagious and dangerous strain, as well as banning foreign travelers from 26 European countries, Ireland, the UK, and Brazil. That came as Minnesota identified the first U.S. case of a virus variant linked to Brazil from someone who'd recently traveled there. The Biden administration calls the travel bans part of its science-driven approach to fight the pandemic.
Stopping people from coming in or us going over there until we get under control, that's going to make it better in the end.
Meanwhile, Moderna's president tells me he believes the Moderna vaccine remains effective against the new UK and South African variants.
What we're trying to do is bring forward a booster that would specifically help people increase their immunity against the South African variant.
And airlines are making changes, too. Starting in February, United will be the first to allow customers to schedule a COVID-19 test through its website. From there, the test provider will alert United directly if a passenger is travel ready. United's CEO tells workers the company is strongly considering a vaccine mandate for employees, which would be the first among major airlines. Yeah, one other note here, and that is that the CDC is urging anybody who comes back to the United States to self-quarantine for up to 10 days. There's no national mandate on how long you should quarantine. It really varies from state to state. So New York may have one rule, Atlanta, LA, Minneapolis, Seattle all have different rules. The CDC is urging people to self-quarantine for up to 10 days as people wait to see whether they've got any symptoms of COVID-19. Allison, back to you.
Mike, the president talking about what this administration is doing to get more vaccines in more American arms and beyond that to get the coronavirus under control. Run us through what he said.
Yeah, Allison, if to the degree that there have been any hiccups and a little bit of heartburn early on in this Biden administration, it has been about the situation they inherited as it relates to our COVID response. We talked a lot during the transition, of course, about the fact that they weren't getting access to certain agencies, especially the Pentagon. Well, this was another big area where they just felt like they weren't getting a full and complete picture from the Trump administration about what our vaccination supply was, what the distribution plan was, and what else was going to need to be done from the get-go. And so what we're seeing now from the president, is after a little bit of time, both trying to increase his view of what is possible in terms of how many vaccinations can be made, but also taking steps to ramp up the supplies in order to make that happen. Let's take a listen to what the president had to say in terms of what he's proposing now.
After review of the current vaccine supply and manufacturing plans, I can announce that we will increase overall weekly vaccination distributions to states, tribes, and territories from 8.6 million doses to a minimum of 10 million doses. Starting next week, that's an increase of 1.4 million doses per week.
And Allison, why this is significant, we just heard, in fact, from New York Governor Andrew Cuomo, who is appearing on MSNBC right now, and he's talking about the fact that his supply in his state is going to be exhausted very soon. And we're hearing this from a number of governors across the country. There is the demand for vaccinations across this country, but not necessarily the supply. So as you heard what the president announced, they're ramping up the available supplies to these states. They're going to try and give them some predictability in 3-week increments about how much supply they'll have. But also, as he said, making some deals with Pfizer and Moderna in order to get another 100 million from each of those pharmaceutical companies vaccinations available. As he put it, I hope in the end we have too much vaccine and not enough.